I mean, I think we've seen on the campaign trail, it hasn't been, the priority issue of a lot of the debates that have happened thus far. But how could healthcare not be a priority issue in the election? I mean, I think that where we are in terms of the implementation of the Inflation Reduction Act, which administration we have, come post-election is going to impact the future of the IRA. And the IRA has been the most significant change in terms of how we pay for drugs in this country that we've had in a number of years. So it's going to be a priority, certainly. We're already seeing some really interesting market reactions to the IRA. Obviously, Medicare has already targeted 10 drugs and is negotiating for those 10 drugs. But we've heard Biden say things like he's going to expand the focus to 50 drugs per year. We also assume that a Trump administration would focus more on going back to some previously discussed policies like MFN and IPI.
Care is not quite as predominant of a topic on the campaign trail as it probably has been in past elections, but to Sarah's points, big implications coming out of this election in terms of healthcare policy implementation for the Inflation Reduction Act, other policies like that. The President Biden and former President Trump have made drug pricing still a part of their platforms for this election. As Sarah mentioned, President Biden would love to expand on the government price setting policy in the Inflation Reduction Act, make that even bigger, apply to more drugs, apply faster. And Trump, you'll recall from his first administration, the focus on foreign freeloading, this idea that America's not getting the best deal on prescription drug prices. There were two past policies that the Trump administration started to enact, but was then blocked by the courts. These things never really came to fruition, but the International Pricing Index model was one attempt. And then there was another model called the Most Favored Nation model. Significance of those two things would be to have international reference pricing be the pillar for physician reimbursement of Medicare drugs under Part B. Really significant policies that were almost enacted under the first Trump administration. If we have a second Trump administration, this focus on foreign freeloading, it's coming back. We'll be looking at those past models as a guide of what we think they might attempt again.